So cataract is basically the opacification of the lens. So we all have a lens inside the eye which is crystal clear. It's like a glass, so that all the rays pass through that lens and they focus on the retina, the behind part of the eye. Sometimes this lens gets opacified, usually because of the age. It could be congenital. Sometimes children are born with the cataract, and there are some cases in which trauma can lead to cataract. So once this lens gets opacified, all the rays are not able to now pass into the retina. So this causes diminution of the vision. So when the patient comes and he is complaining of the cataract, first we do a proper dilated fundus examination and the cataract evaluation. We just put some drops in the patient's eyes. We ask him to wait for 15-20 minutes, and then we see on a machine called slit lamp, in which we can see properly what is the grade of the cataract. There are different grades of the cataract according to the hardness of the lens. So once the patient is good to go, once he is ready for surgery, for the cataract surgery, we ask the patient to do certain tests to see whether his blood sugars are under control, his pressures are normal, whether his eye pressure is okay. We do all these tests, and then we'll ask the patient to put some drops in the eyes, some antibiotics, so that the eye is little sterile. So then we put some dilating drops before the surgery so that we can approach the lens properly. After that, once the surgery is done, we give certain precautions to the patient, like the water should not go in the eye for around a week, and he has to put the drops regularly. Other than that, the patient will be able to see clearly exactly in a day or after a few hours only. So after surgery, you might experience a little foreign body sensation, mild irritation or some watering, which is absolutely normal. You need not worry about it. It will go once the drops wane off with time. Other than that, just don't wash your hairs, because these days the water may have chlorine or some bacteria which can go inside the eye and cause infection. And the doctor will advise you when you have to come for the follow-up that you have to follow regularly. You have to put your medications regularly. Other than that, there are no major precautions to be taken. So the different types of lenses that are available these days are monofocal. It's a traditional lens in which you'll get a clear distant vision, but you won't be able to see very clearly for the near or intermediate distance. For near and intermediate, you need to wear a proper glasses. It could be around 2.5 or 3 diopters. So these days, better lenses or according to patient's needs have come. One is advanced monofocal lens. In advanced monofocal lens, you'll get a good intermediate vision, and even your near needs will be slightly reduced. Like if you want to see the mobile, you have to increase the font of the text a little bit and you'll be able to see it clearly. But of course, if you want to see very small letters, or you want to read a newspaper, then you'll have to wear the glasses. So we have these days the trifocal lenses as well. The trifocal lenses will correct your distance, intermediate and the near vision. So your requirement for the glasses will be minimal, or it won't be there. The only slight issue with the trifocal is that the patient will get a little bit glare. So if you are a driver, if you are a frequent highway driver, or if you need a clear vision during night time, that in those cases we advise you not to go for the trifocal lenses because of the glare issue. There are the powers which are called the cylindrical powers, which do not go with your regular lenses. If you have a cylindrical power, we need to put a special lens called toric lenses. The toric lenses, they come in monofocal, advanced monofocal, in trifocal, in everything. We have toric lenses. So if you are experiencing any blurring of vision, any glare, if you're not comfortable with your vision, visit a ophthalmologist near you. Thank you.
Follow Center for Sight and post your queries to get answers from the experts.